Okay, good morning, ladies and gentlemen. We're back to the continuation of our lesson yesterday about the communication in the business setting. But today we'll be discussing communication in the health industry. Okay, so again, welcome to the University of Mindanao virtual classroom, and this video is for the exclusive use of the University of Mindanao virtual classroom purposes. Okay, so in as we proceed, what is the importance of communication in healthcare? So, for hospitals and healthcare institutions, ensuring that patients receive proper care takes more than performing procedures and making diagnoses. Communication is a crucial component in all steps of the healthcare process. So, whether it be a clinic accurately sharing patient information with another facility, or a group of doctors, nurses, specialists, and other staff at a hospital discussing how to treat current and incoming patients. So, the need for concise and effective communication is always present in the health field. So, organizations with strong communication policies can enrich their patients' health, while those that have effective procedures in place can negatively impact patient well being. So, healthcare professionals and institutions need to recognize the importance of communication in healthcare to thrive. Okay, so how better communication practices are beneficial especially in the health industry. So, poor communication has been a factor in 1,744 patients' deaths and over $1.7 billion in malpractice costs nationally in the past 5 years. Can you imagine that? So, according to a study published in Fierce Healthcare, this shows that better communication methods would benefit both patients and healthcare providers. So, effective communication, like both intra hospital and inter hospital, is important for healthcare providers to protect their patients, save on costs, and increase day to day operating efficiency. Meanwhile, patients benefit from increased access to their medical histories, which reduces the chances of medical errors. So, there's a need for hospital employees or those who are involved in the operations of the hospital. It's within the hospital or between hospitals. There's a need for them to really have better communication for the sake of the patients primarily, and of course for them uh, to benefit on a lot of things, particularly financial and efficiency between hospitals. So there's a focus on patient safety. When considering the importance of communication in healthcare, patient safety is one of the top reasons to create an effective communication structure in any healthcare organization. Inadequate communication is often a leading cause of in-hospital deaths. In a retrospective review of 14,000 in-hospital deaths, communication errors were found to be the lead cause. Can you imagine that? So that's twice as frequent as errors due to inadequate clinical skill. So notes a 2006 study in the Clinical Biochemistry Review. So that really hurts, especially if the victim or is your relative or somebody close to you. And the reason why she died or the person died is because of miscommunication between hospital personnel. Yeah, and that's hard to accept. So, while communication errors can have severe consequences, these issues are often relatively easy to fix. So, meaning many patient deaths caused by communication errors are preventable or avoidable. So, that fact alone is one of the most important reasons why communication is so important for patient safety. Okay, so Inter-hospital versus intra-hospital communications. What's the difference? So there are two types of communication methods that healthcare institutions use that are crucial to patient safety and well-being. So we have inter-hospital and intra-hospital. So when you say inter-hospital, inter-hospital communications involve information sharing among multiple sites or institutions. So this includes transmissions between facilities owned by the same organization and between completely separate healthcare entities. So moving patients from one facility to another, sending medical records and transporting vital medical equipment all require clear communication between sites. So for example, I remember I had a student way back in UM Ganga who accidentally hurt his neck. He was playing in the field, tumbling around, when I think he twisted something in his neck that he can't move anymore. So he just sat there, and we called for 911. And when they came over, they put a brace in his neck and conducted like a medical investigation on what happened. So they made a summary, or what they call this, an incident report of what transpired. So we transported the student to the Davao Regional Center, Medical Center, and there they just simply submitted the incident report to the hospitals, and the hospital were able to get it from there. Okay, so they were able to proceed without a lot of questions. So the treatment was fast, and in a matter of a short time, the student was out of the hospital after conducting a few tests. So it made the transition easier because of the existing communication and the proper turnover of information from the ambulance to the hospital itself. Okay, so however, hospitals often encounter obstacles in communicating effectively with one another. So a study conducted by the Center for Health Information and Decision Systems, or CHIDS, found that poor inter-hospital communication costs the industry upward of $12 billion annually. Can you imagine that? That's times 50. That's how it is in pesos. 12 billion times 5 is around 60 billion. Is it? No, 600 billion pesos every year. That's a big amount of money. So well, let me check here. Let me adjust the volume. Oops. I think the volume is okay. Moving on. Let me just be sure about this for a moment. Okay, moving on. So inadequate communication drives up costs by preventing institutions from accessing patients' medical files, which may create a need for duplicate tests and second opinions that would not otherwise be necessary. For example, the patient has already been tested and to a laboratory in that hospital, doesn't have to conduct the same tests when he arrives or he is transferred to another hospital. So that would be very costly, and of course we were considering the time constraints. So precious time is also valuable, especially for emergency purposes or emergency cases. So having a good communication system within inter-hospitals, between institutions, can save a lot of money and time and effort. Okay, now intra-hospital is something to do within the hospital itself. So problems with communication also occur among personnel within the same hospital. So intra-hospital communication is any information sharing within a singular institution. So whether it involves coordinating room changes, scheduling surgeries, assigning further tests, or even setting up appointments. So when doctors, staff, patients are not effectively sharing information, so the efficiency of each process may decrease, potentially resulting in unnecessary costs or even endanger the patients. So patient records delays, lack of procedural coordination, and even serious medical errors may all be consequences of poor intra-hospital communication. So as much as possible, they want to avoid those costly problems. Okay, so what are the common communication methods? So each healthcare system has multiple forms of communication that administrators and staff must be trained to use properly and efficiently. So when even one of these communication methods fails, patients' safety can be put at risk. A minor printing mistake, for example, could lead to incorrect dosages or incomplete information that may keep a doctor from knowing about a crucial allergy. That's why in some medicines, uh, they really write in there that if you have an existing allergy to certain chemicals, this cannot be administered to you. So just because the person is allergic to peanuts, for example, that can really cause a lot of serious problems if ever. So you have, as a patient, you have to really disclose everything that the doctor needs to know. Or as a doctor, he needs to transmit relevant information to the nurses who administers the medicines at what particular time and at what particular uh, dosage. So understand how standard communication methods work is the first step in ensuring that the hospital is running as smoothly as possible. So for both the patients and the hospital's sake, to that end, there are some of the most common ways that hospitals and other healthcare systems communicate and share information. So transmitting patient data. So patient records are shared securely via inter and intra-hospital communications. So delays in receiving records can cost hospitals millions of dollars each year in unnecessary expenses. So patient data are used to create a thorough medical history and provide appropriate medical care. So even your years of medical history are still relevant for present analysis of situations or medical cases. So when patient data aren't shared between departments or other healthcare organizations, there may be much um, there may be a much higher chance of practice errors and subsequent increased costs. And they want to avoid those situations. So sharing research findings. Okay, so the healthcare industry relies on research to create and improve tools and procedures. However, some third party researchers, such as those who work for private companies or pharmaceutical labs, are reluctant to share their findings with providers because of competitive pressures in their industries. So the lack of access to the latest research can stall medical advancement or can prevent or delay medical advancement. It can even waste funding and negatively impact health outcomes. So, according to an article published by Forbes, for healthcare techniques to evolve, providers must implement communication systems that allow researchers to quickly and easily collaborate both within the same organization and across multiple organizations. Let's take, for example, the case of our COVID 19 vaccines. So, these vaccines are are products of the work of different laboratories and different health companies. Therefore, they have to really work together and coordinate with each other in terms of sharing information of what works best to come up with a cost effective and at the same time efficient um, and accessible and affordable vaccine for everybody. So, uh-huh. So there's a need for collaboration with colleagues. So intra-hospital communication relies heavily on collaboration between colleagues. So patients, lab technicians, doctors, and staff all need to be in constant communication to create a system that operates as smoothly as possible. So intercolleague collaboration also includes entering information accurately into databases, especially shared ones. So inaccurate communication between departments can lead to errors in database entry, which in turn can potentially risk patient safety. So for example, there's the DNA map of a human body has already been completed, probably by the works of collaboration between hospitals and between experts, medical experts. Now what they did is they put it in internet for everybody to access it freely. So and that kind of information is accessible for everybody who needs it. And that would be very helpful. And that's because of the collaboration other with other agencies like the WHO. For example, right now there's a video being shared about from seemingly medical experts who share that there's no need for lockdowns among high population countries in terms of dealing with COVID-19 because COVID-19 is, they say, is a seasonal. It's like December to April thing. So, but I don't know if there's much truth to that. There needs to be more thorough studies and research about how we should deal with the COVID virus in such a way that it won't affect much of our economy. It won't affect much of our convenience. So that's why there's a need for more research. For example, we have this motorcycle barrier thing. The thing is, it just comes out of an idea of the head of the, I think, transportation department on how to deal with motorcycle riders and their back rides. So he just simply said that, well, probably we can use some barriers, but the thing is, it's not even proven by research or stuff that barriers can prevent the virus from entering into the other person's body or to the back ride. In fact, there are even tests that outdoors in a high speed, the barriers won't matter anymore. The air would still pass through the other person. So I think the best thing to do is just to protect the mouth, to cover the mouth of the driver, like in a full-faced helmet and with the masks on. So I think that would be impossible for the virus to be transmitted to the back ride already. There's no need for the barriers to be implemented. It's such a very costly and at the same time very inconvenient solution for prevention of COVID virus. It's not even effective. So that's one of the things that research needs to prove or disprove. Okay, next, coordinating hospital leadership, whether publicly or privately funded, hospitals are businesses and they need to operate as such. So hospital managers and other leaders must frequently communicate with doctors, staff, and patients. All hospital leaders and managers not only oversee administrative staff and tasks, but can also play a vital role in individual patient healthcare plans. So to be effective, they should maintain open lines of communication with those around them and to facilitate information sharing between hospital departments and with other institutions. So finally, we have telemedicine advancements. So healthcare professionals are increasingly embracing telemedicine, so which involves using a variety of internet-connected technologies to serve patients remotely. So these technological tools play essential roles in healthcare communications, according to the American Telemedicine Medicine Association. Hospitals and other healthcare organizations use internal online networks, or we call it intranets, to create more efficient communication processes. So this makes patient record sharing and cross-departmental communications much easier. What once may have been what once may have been communicated via printed files and memos can now be shared electronically within the organization and sent to other organizations. Right? What it could be, they could scan these documents and print them and send them to other organizations easier. So because it's now in electronic form, some books are even now printed as ebooks that can also be shared to between departments or within the hospital itself or within the organization itself. So telemedicine goes even further by allowing patients to receive medical care and advice from the comfort of their own homes. Using state-of-the-art communication tools, patients and healthcare providers can discuss health concerns via video chat, often eliminating the need for the patient to visit the provider's office. Not only does this cut down costs for both the provider and the patient, but it also creates a seamless communication experience for everyone involved. So for example, we have in we have this uh, healthcare provider, the Value Care. So when the COVID thing happened, they used to have that office at the multi-test. So whenever we go there for a checkup, we have to drop by the office first to secure an approval so that we can avail of the checkups for free. But since we have the COVID thing, they gave out I think an email address. They just posted an email address of the Value Care company. So we have to communicate there and request for checkups, for example. So, and they reply promptly as to what doctor to go, and they provide an approval sheet, which we will download and we'll have it printed. So, and the printed copies will be brought directly to the doctors where we want to be checked. So there's no need for us to visit the office anymore, and that's very convenient. It keeps us from uh, filling in lines in the office, so avoiding it even promotes physical distancing between patients because there's no need anymore to go to the clinic so it's very convenient and very efficient as well. So that's it for the need for communication within the healthcare industry. And tomorrow we'll be discussing how it goes in an educational organization. So I hope you keep track of watching these videos, because at the end probably of these lessons, when we finish everything about communication, we'll have a short quiz to check of your recall and understanding of these lessons. So that's it. God bless and see you again for the next lesson we have. Bye bye.